Welcome to Chatting with Chitness. My name is Dr. Salil Chitness, and I'm double boarded in general pediatrics and pediatric emergency medicine. And I'm here today to provide medical knowledge to all you parents out there. If you have a true concern about your child, please go seek the advice of a medical professional. Let's get chatting. All right, today we're going to talk about RSV. RSV stands for Respiratory Syncytial Virus. What does that mean for you and me? It means just a regular old common cold. But if your child is under 1 year old, or if you had a premature baby, or a child that has respiratory issues, then this virus is very dangerous because it can cause inflammation in your child's lungs that makes it hard for them to breathe. And the problem with the virus is there is no medication for it. We all have to do supportive care, which is very frustrating because you can't make your child better quicker, which is what we all want. But what does supportive care mean? Well, when it comes to RSV, it means suctioning your baby. All that nasal congestion makes it hard for them to eat, makes it hard for them to breathe. So you want to suction as much as you can, especially right before you feed. You need to make sure they're hydrated. One of the biggest dangers of RSV is that your child will not eat as well, and then they get dehydrated, and that becomes an issue. The thing that you need to look for when it comes to RSV is how fast your child is breathing. If they are breathing 60 breaths a minute or more, which is at least 1 breath a second or more, then you should be concerned, especially if it's going on for hours. You will see their belly going in. You might hear grunting, and you might see their head bobbing, which are all not good signs and signs that you probably should see a healthcare provider. When it comes to fluid intake, what we look for is 3 wet diapers in 24 hours. So if your child has 3 drops of pee every 8 hours, you're okay. But they need to have 3. There's also a new vaccine for RSV that just came out this year. If you want to know more information about it, I will provide it in the description below for this video. And you can always seek out your healthcare provider to ask for more information. But the studies show that it is very promising and actually reduces a lot of hospitalization, which is what you want for your child. You don't want your child to be in the hospital. You want them home. And another thing with RSV, and the most important thing, is that your child will have a fever with RSV, but you need to treat the fever so that your child feels better. Check out my video on fever management. I think it is the best way to treat your child's fever and keep it from coming back, even though if it comes back, it's okay. But we all know that when your child has a fever, they don't feel good. Also remember that when it comes to RSV, it's all supportive care and just being vigilant on seeing the signs and the symptoms that are concerning that I went over earlier in the video. Please leave comments so we can chat about it next time on Chatting with Chitness.